Hi everyone, my name is Jay Randhawa. I'm the founder and chairman of I'm He, Her Charitable Trust. We have got doctors from all over New Zealand who will give you the information on prostate cancer in your own language.
The prostate is a gland that sits here under the bladder and in front of the lower bowel. The most important function of the prostate is to produce a component of the semen. As you can see, the urethra passes through the prostate, and that is one of the main reasons why patients with prostate problems present with urinary symptoms. Prostate cancer is obviously a cancer, it's an abnormal growth. Benign prostatic hypertrophy is also an abnormal growth, but it is not malignant. The main risk factor for benign prostatic hypertrophy is age, and many men as they age will develop an enlarged prostate. We do not know what causes prostate cancer in an individual. However, looking at population data, there are certain risk factors that have been identified. These include age. The older the person, the higher the risk of prostate cancer. The race is also been found to be relevant, with prostate cancer being more common in Western countries and less so in Asia and Africa. The other risk factor for prostate cancer is family history. If you have a brother who has prostate cancer, the risk goes up 2 times that of the general population. If you have a father and a brother who have been affected by prostate cancer, the risk goes up 3 times. In real terms, this may be almost a 50% risk of developing prostate cancer by the time one is 75 years of age. Prostate cancer is rarely hereditary. This can be suspected if there are 3 or more relatives who have been affected, first-degree relatives, I must add, who have been affected by prostate cancer. If there are 3 generations of a family who have been affected by prostate cancer, and if you've had 2 first-degree relatives who have been affected by prostate cancer less than 55 years of age. As shown earlier, the prostate gland is situated below the urinary bladder, and the urethra, or the tube that carries the urine, passes through the prostate gland. Any enlargement or abnormality of the prostate gland can affect the flow of urine through this urethra. As a result, a common symptom of prostate cancer is urinary symptoms. Patients are unable to pass urine freely. The flow may be restricted or obstructed. Sometimes there may be blood in urine. Sometimes prostate cancer can lead to other symptoms such as bone pain. This is because prostate cancer has a tendency to spread to bones. The 2 tests that are available include a digital rectal examination, or DRE, and the prostate specific antigen test done with the blood, or the PSA test. Neither of these are confirmatory, but the results are taken by the doctor in conjunction with the clinical circumstances to decide if there is a chance that the patient has prostate cancer. The DRE examination is when a doctor or a nurse inserts a gloved finger into the lower bowel in order to try and feel the prostate gland towards the front. The PSA test is a blood test. The normal ranges are known, and the patient's results can be compared against this to see if there is a risk of prostate cancer. Should be noted that there is no absolute value at which prostate cancer can be confirmed. However, the risk increases with the higher values. Many factors can influence the PSA result, only one of which is cancer. Other causes include benign prostatic hypertrophy, infection or inflammation of the prostate, recent ejaculation, even exercise such as cycling, because there may be a degree of prostatic massage. The other thing to remember is that blood test, the PSA blood test, should ideally be done before any examination or biopsy of the prostate, because this can falsely elevate the result. It is ideal to discuss the result with your medical practitioner, who will assess the absolute value of the result and take this in conjunction with your symptoms as well as your personal circumstances to try and gauge the risk of you having prostate cancer. If the risk is deemed high enough, then he may refer you to a urologist for further investigation, especially the biopsy test. The biopsy test is the only thing that can confirm presence of prostate cancer. At the moment in New Zealand, there is no general recommendation for population-based screening for prostate cancer. However, if one is concerned, then you may discuss screening with your medical practitioner at the age of 50 or above. If, however, you have a family history, then you may want to consider screening tests at a younger age, either 40 or 45. Unfortunately, there is nothing in particular that you can do to prevent prostate cancer. There are a few factors that may be relevant, such as diet or increased body weight, and this can be modified through lifestyle manipulation. Man up. Give prostate cancer the finger. Don't die of embarrassment. Get yourself checked.
Man up and give prostate cancer the finger. Don't die of embarrassment. Get checked.
Man up, give prostate cancer a finger. Don't die of embarrassment, get yourself checked.